Pain is one of the most common and dreaded sequelae of cancer, occurring in approximately 55% of cancer patients during the course of their illness. It is especially prevalent in the advanced cancer population, with 2 out of 3 terminally ill patients suffering from it. Pain is a multidimensional construct that affects different facets in a patient's life. The occurrence of pain takes a toll on patients' quality of life, affecting daily functioning, mental health, and social relationships. Despite the need to address this aspect of cancer care, many patients do not receive adequate pain management, with up to one-third of cancer patients suffering from persistent pain. In the Philippines, there is a lack of studies exploring pain among cancer patients. There's a need to better understand the experience of pain among Filipino cancer patients, so that appropriate treatment may be provided. Our study determined the prevalence of pain among patients with cancer at the UP-PGH Cancer Institute. We also described pain severity, its impact on daily functioning, and the adequacy of pain management. Over the course of a 2-month period, a cross-sectional study was conducted at the UP-PGH Cancer Institute. These were our inclusion and exclusion criteria. Demographic, clinical, and pain-related data were gathered from patients. The brief pain inventory was used to evaluate pain severity and its impact on daily functioning. It evaluates pain at its worst, least, average, and current state to encompass the range of pain experience. Meanwhile, the adequacy of pain management was assessed using the Pain Management Index. The PMI is calculated by subtracting the worst pain score from the analgesic score. A negative PMI denotes inadequate pain control, while a score of 0 and higher signifies adequate pain control. Patient factors were assessed in relation to pain severity and adequacy of pain management using logistic regression analysis. A total of 351 cancer patients were included. The median age of patients was 51 years old. Majority of patients were female, unemployed, with household income less than 10,000 pesos. Psychological support was obtained mainly from the family. Breast cancer was the most common type of malignancy, with most patients having stage 4 disease. Despite the advanced stage of sampled patients, only 2% of them were referred to hospice service. Most of them were undergoing chemotherapy, with a little more than half of them having regular follow-up with their medical oncologist. Among included patients, 303 experienced pain out of the ordinary. The most common sites of involvement include the back, lower extremities, and the abdomen. Patients experience predominantly chronic cancer-related and somatic pain. In terms of worst pain, majority of patients experience severe pain. Total pain interference was mostly severe. More than half of patients use pain medications, with combination tramadol paracetamol being the most commonly used analgesic. Interestingly, only 21 patients were given morphine, and only 25 patients were referred to pain service. Among the 351 patients, 59% had inadequate pain management, with most receiving a PMI score of -1. The adequacy of pain management differed significantly based on the severity of pain. 46% of patients who experienced mild pain received adequate pain management. In contrast, only 37% of patients with moderate pain and 16% of patients with severe pain receive adequate pain control. Multiple logistic regression revealed that the use of morphine, severe total pain interference, and regular follow-up were significantly associated with worse pain. Specifically, patients who were taking morphine were 8.6 times more likely to report severe worse pain. Moreover, patients who obtained a severe rating on the total interference scale were 3.2 times more likely to experience severe worse pain. On the contrary, patients with regular follow-up were 65% less likely to experience severe worse pain. Multivariate logistic regression identified female sex, use of pain medications, pain interference, and referral to pain service as the only factors associated with adequacy of pain management. Females were 62% less likely to report adequate pain control. Furthermore, patients with severe pain interference were 75% less likely to experience adequate pain control. On the other hand, patients who use pain medications were 14 times more likely to report adequate pain management. Finally, patients who were referred to pain service were 6.6 times more likely to report adequate pain control. Our study showed that 86% of included cancer patients experience pain, with majority of them suffering from severe pain that significantly impaired daily functioning. Despite its prevalence, pain was inadequately managed in 59% of patients. Additionally, there is a low referral rate to pain and hospice service at 7% and 2% respectively. Comparing results with those previously reported in literature, we can see that the prevalence of pain and its undertreatment was higher in the present study. Some limitations of the study must be acknowledged. Given that the study was cross-sectional by design, it was only able to encapsulate the pain experience of patients during a particular time period. Furthermore, we are not able to assess the reasons why patients were not able to obtain adequate pain management. Timely screening and assessment of pain is crucial to identify its presence and the need for analgesics. Proper training on evidence-based pain management should be instituted among medical oncologists. There is a need for medical oncologists to work together with pain and hospice care services who can assist in optimizing cancer pain management.